In this video, you'll learn which myths about the all-on-4 technology or all-info technology are real, and which ones are just myths. Watch this video until the end and you'll understand which rumors you shouldn't pay attention to. Myth number 1. The all-on-4 technology is a complicated and painful procedure. In fact, the all-on-4 technology is not simple. But if the team of doctors at the clinic has extensive rich experience, specifically in this technology, this necessarily requires the experience of a surgeon, the experience of an orthopedic doctor, and the experience of a dental technician. So this procedure goes quite easily, even in the most complex cases or challenging implant situations. So, if the team has experience working with this technology, then the all-on-4 procedure is definitely not that complicated. I emphasize that it's even simple just because it has been refined and tested. Second, is this procedure painful? In fact, the procedure is completely painless. As we always say, the most unpleasant part is this is literally the first minute of the implantation procedure. So, this is the time it takes when the doctor administers anesthesia. So the doctor numbs those areas so that you don't feel anything. Although the needle itself is definitely ultra thin now. But nevertheless, it is quite uncomfortable. So you need to endure literally the first minute before the implantation procedure. While the doctor is numbing everything, you won't feel anything at all for 2-3 hours. So, go ahead and confidently decide to have this procedure. Don't be afraid of pain, it's completely painless. Myth number 2. All-on-4 requires a long recovery period. In fact, the recovery period with the technology is all 4. It is absolutely no different from the recovery period, for example, with a single implantation, when the patient has, for example, just one implant installed. Most often, this period takes no more than 10 to 14 days or 2 weeks. Usually, that's enough. It is also worth noting that it plays a huge role that the patient follows the recommendations. How the patient follows the recommendations, this is very important. Recovery periods. Everything that the doctor prescribed, everything that the doctor handed over, must be strictly followed. Plus, specifically in our clinic, we speed up this process. So we provide the patient right here with a special list of medications. And it's completely free. It's a whole package of medications that the patient will take over the next 10-12 days. So everything has already been thought out. Everything has been designed for the patient so that we have avoided or minimized all risks. And the most important thing is that the recovery period for us took the expected 10-14 days. Myth number 3. The all-on-4 technology is only suitable for elderly patients. In fact, it is traditionally believed that most missing teeth or complete tooth loss is more commonly seen in elderly patients. After all, mostly young people still have their own teeth and they don't need to restore their teeth as they still have them due to their age. That's not entirely true or not always the case. So this technology is suitable for both elderly and young patients. The main point of this technology is to address the issue of missing teeth. So teeth can be missing in both young and old people. If we talk about our experience, the youngest patient in our clinic was 26 years old and the oldest, let's say, was 91 years old. So in this technology or with this technology, we absolutely cannot talk about age. Age is neither a contraindication nor any kind of limitation. Our main task is to restore the patient's teeth. So age is neither a criterion nor a limitation here. Myth number 4. The all-on-4 technology is not suitable for smokers. Of course, patients who have such a harmful habit as smoking are considered to be at risk. After all, smoking directly affects the further functioning and even the integration of implants. In modern implantology, we always say there are only 2 enemies. It's smoking and hygiene. There are no more enemies for modern implantation. From this, it's clear that smoking plays a huge role in the integration of implants. So, even if a patient smokes, it's not a direct or complete contraindication. We have such patients, so we ask that if a patient finds it very difficult to quit smoking, they should at least limit the number of cigarettes they smoke. As a rule, this should be done at least 2 weeks before the start of the implantation procedure, so that the patient directly limits the number of cigarettes they smoke. And the same goes for after the implantation procedure. For at least 2 to 4 weeks, they should also limit the number of cigarettes they smoke. Also, in this regard, drinking a lot of water really helps, so that if the patient does smoke, they should drink plenty of water to replenish their water electrolyte balance. Myth 5. The All-on-4 technology is not suitable for patients with gum diseases. This is quite a common, if not the most frequent, myth. Patients often ask about having periodontitis. Periodontitis, bleeding gums, that he has his own teeth, that he even has his own teeth falling out completely healthy. And they say that I can't have this kind of implantation, the implants won't hold. This is absolutely not true. So as far as periodontosis and periodontitis are concerned, this is most often the case. Or rather, this disease is directly related to one's own teeth, meaning it is a disease of the natural teeth. The most important thing, the initiator, or the main reason for this is the infection that is already deep in the pocket, or deep on the roots of our teeth, which leads to loosening or complete weakening of the ligament, causing the teeth to fall out. So the main agent is, of course, the infection that is in your teeth, and it has already gone deep into the bone. So as soon as we remove this agent, then there are no problems with periodontitis and periodontal disease. That is, I emphasize, periodontosis and periodontitis are diseases of one's own teeth. Implants do not have such a disease. This is very important. So as soon as we remove this agent, as soon as we take out these teeth, there will be no disease. So when installing implants, this will not affect, most importantly, the integration and further use. So don't be afraid to get implants with such technologies. On the contrary, do this much faster, because the process, agir, of inflammation in the bone, which unfortunately occurs with periodontal disease and edentulosum, that's exactly what eats away at our precious bone, or let's say that's how we lose our bone. And what will happen then is that, on the contrary, it won't allow us to install these implants. So don't waste precious time. Instead, either treat your teeth. Thanks to the same periodontist, there is now a very specific focus for such problems. This is a periodontist. You can save such teeth, and most of the time it prolongs their life, so it can be done. But if you don't have the time and energy for that, then of course it's better to remove such teeth quickly and get implants. Otherwise, we simply lose bone, and then the recovery and rehabilitation period will be much longer. And the Van Doroge Myth 6 technology, All-on-4, requires constant care. In part, that's absolutely true. You need to pay very close attention to hygiene with this technology. As we mentioned earlier, modern implants have only two enemies. It's smoking and hygiene. So hygiene is also a very important factor. So care is definitely very important. You will need to take care of the future structure, or the structure that will be on the implants, at least 3 times a day. But at the same time, this care is completely simple or quite ordinary, and with proper attention or the right skills. It won't take up so much time and won't weigh you down too much. So the most important thing is to master these care techniques, and most often it's the irrigator, specifically first and foremost, the irrigator. This is a special device where we fill it with water, and under pressure the water is delivered. In this way we usually wash out those spaces between our structure. And the gum, which unfortunately you can't, let's say, you need to take care of it differently. So the irrigator is definitely essential, and of course our traditional toothbrush as well. That's why the toothbrush. The irrigator is a key companion not only for patients with their own teeth, but also for those with artificial ones. That's why it's essential to use the traditional irrigator and toothbrush for hygiene. Also, when it comes to care, of course, we need to pay attention to it. It's visits to the dentist and with healthy teeth, which means traditionally once every 6 months. It's definitely necessary to maintain this structure. Or let's say for patients with this all-on-4 technology, they must definitely come to the orthodontist once every 6 months. Most often this involves the doctor, removing the structure, cleaning it, and sometimes this is done right in front of you. Sometimes the doctor can take it away for 1 day, that is, the patient can certainly remain without teeth, but this is literally for 1 day in order to do this in laboratory conditions. But in any case, cleaning of this prosthesis is mandatory, so to speak, within the framework of the dental chair or directly in the dental chair. Therefore, the main points are an irrigator, a toothbrush, and visits to the doctor. If we follow all these points ourselves or have followed them, then you can absolutely not worry about further use. Then you are doing everything right. And we guarantee that the use of both this structure and the installed implants will, let's say, be lifelong and practically last for the rest of your life. Myth 7. With the all-on-4 technology, the teeth look somewhat unnatural, not natural, and they won't resemble your own. In fact, this is the most common misconception and myth. Why is it called the dental technology industry? Because, of course, our future teeth or your future teeth are made or sculpted by a dental technician. Of course, this is done under the guidance or direction of the orthodontist. So the dental technology industry has come a long way. And those materials that are now used for, or we will call fittings, to which it is applied in a very modern way and absolutely close to natural, to the ideal. So even for me, let's say, for someone experienced, it's often very difficult to distinguish, and sometimes it's even hard to tell apart. At that moment, the patient has real teeth or they don't. So for this, you definitely need a chair. You need light. And sometimes you have to dry the teeth, yes. And only then can you really distinguish real teeth, whether it is or not. So in our real or everyday life, of course, we don't do that. Nobody does. Therefore, to distinguish, it's very, very difficult, even for a specialist, to distinguish artificial teeth from real ones, especially since it's also very important that the orthodontist with you in the chair decides which teeth will be used. He shows you a special shade guide called the Vita Shade Guide, and you work together with the doctor. Choose the shade of the teeth, the color of the teeth, even the transitions from darker to lighter. So right now there is such a wide and rich selection. So of course a lot depends on you, which color you choose. But if we talk about some standard classic color or standard classic approach, then the teeth are as natural as possible. And they are very beautiful. And distinguishing them from artificial or real ones is practically impossible. Myth 8. The all-on-4 technology is not suitable for patients with a lack of bone tissue or with bone atrophy or with the absence of bone tissue. That's absolutely not true. The all-on-4 technology was actually designed for patients with a deficiency in bone tissue. So ideally, of course, we should place 8 or at least 6 implants. This is not always possible, and unfortunately, as we age, the more time we have, the less time we have. No, the fewer teeth we have, the faster and more significantly the bone deteriorates, and accordingly, it becomes physically impossible to place implants. Well, there's just nowhere to put them. That's why it was developed for patients with minimal bone quantity or with significant atrophy of that bone. So, the technology itself, I emphasize, was created for this purpose and allows patients when there are absolutely no conditions. Let's call the all-on-4 technology a lifesaver for full implantation. Or the technology itself actually saves such patients and helps them get their teeth back. Myth 9. The all-on-4 technology has a low success or survival rate, or the patient worries that everything will go wrong. So this is actually a very common myth or a frequent question from patients. And it is, of course, directly related to the experience of the surgeon, the experience of the prosthodontist, and the experience of the dental technician. Absolutely. This is also related to, let's say, a certain systemic level or systemic condition of the body. That's why, specifically in our clinic, we always conduct blood tests and a CT scan. And thanks to this, we assess the situation before the implantation procedure. What happens to the patient and their body at a systemic level that allows us, so to speak, to make some kind of prediction? And immediately voice this to your patient and say that we see risks. How can we warn? Or let's say to act proactively, precisely, because of these tests and this deep understanding before the implantation procedure. Another important point is, of course, the recommendations. So if the patient follows all the recommendations, specifically when we talk about our dentistry, then all these issues that have been experienced personally. So let's say these are our personal screw-ups. That is, at every moment that, God forbid, arose, let's say we studied it, understood it, and made sure it never appeared again. So if you follow all the recommendations and listen to your doctor, everything will go completely, let's say, predictably and as planned. And most importantly, with a guaranteed result. Myth 10. The all-on-4 technology is too expensive, or it's too expensive technology. In fact, the all-on-4 technology is budget-friendly. Or let's say it depends on what you're comparing it to. If we're talking about removable dentures and the all-on-4 technology, then of course, let's say removable dentures will win in terms of price. And if we're talking about the technology, all-on-8, all-on-6, the reason I mention all-on-8 and 6 is that ideally we should install 8 implants or at least 6. So the all-on-4 technology, of course, looks completely different. Let's say, specifically, if we talk about the all-on-8 technology, this technology starts at around 1 million rubles. And if you compare it with the all-on-4 technology, about 255, then, of course, if you look at it with such a difference, then the all-on-4 technology is, let's say, very cheap and accessible. And that's why it's always better to understand what we're trying to compare or why we think that way. Another very important point regarding the technology itself is that it can happen, and it's not uncommon. When it comes to the all-on-8 technology or the all-on-6 technology, it's just that physically the patient isn't not suitable simply because they don't have enough bone volume. Or let's say, as we call it, there's nowhere to place the implant. The bone is very thin and it's not practical to augment it. We inform patients immediately. Don't waste time. And the patient is left with only one choice, the all-on-4 technology. So I want to emphasize that there's a very important point here, which is communication with the doctor. At least with our patients, we weigh all the pros and cons together regarding the all-on-8 technology and the all-on-6 technology. Thank you. Also with the all-on-4 technology. We weighed everything, understood it all for ourselves, and only then do we decide what we choose. And the most important thing is what we choose. Of course, most often patients vote, let's say, with their wallets, or they vote with price, right? And the patient decides for themselves which technology they choose. But to say that this technology is expensive is completely untrue. I emphasize it depends on what you're comparing it to. I hope I've dispelled all your myths and answered all your questions. Write in the comments which myth you'd like me to make a separate video about. I still have a lot to share about each of these points. And if you want to get a personal consultation from me regarding your specific clinical case, click the link below and message us on WhatsApp or visit our website and leave a request. We'll get in touch with you. Take care of yourself.